My name is Christine Roman, and welcome to Roman on CVI. Today I'd like to talk a little bit about the confound of a child who has both ocular and cortical visual impairment. A lot of people have a belief that the CVI range can only be used with children who have cortical visual impairment or CVI alone. If that were the case, the CVI range would probably be limited to a much smaller group of individuals. It is quite common for children with CVI to have some additional ocular concern, and those concerns are best identified and understood through an eye report provided by the ophthalmologist or optometrist. The most common coexisting ocular concerns that I see, and I have data of almost 1,000 children from pediatric view, are strabismus, refractive errors, and optic nerve differences. From conversations I've had with eye care specialists and substantiated by my own observations and things that parents also share with me, when both exist, CVI would likely not even be diagnosed if the ocular condition could explain the child's functional vision. That in most cases where CVI is diagnosed, the ocular consideration is something that must be understood and must be considered, and we must provide support for, but it is not the preliminary reason or the primary reason that the child has difficulties with functional vision. So we generally approach this as a child who has CVI and some ocular concerns, all of which have to be thought about together. How do we do that? Well, in the 2018 publication of my book, there is a document called the CVI progress chart. And in this progress chart, and this isn't a revision of a document that existed since 2007 in the first version of my book, that document is really used to help consider both ocular and cortical visual impairment when they both exist. And so there's a way to score that in which we carefully think about whether this behavior could be attributed to the characteristics of CVI, the characteristics of an ocular condition, or both. And where both could be the potential answer, we mark that, designate that with a letter O as a way to sort of consider this as these two things impacting each other. Over time, if we see that behavior sort of begins to resolve or goes away or becomes more typical, then it probably was always the CVI and not the ocular consideration. But there's so much more to that, and I encourage you to take a look at the progress chart in my book if you can. The bottom line, the major message here is that the work that I do, the work that I promote, is not really designed for children who have CVI alone without the consideration of their ocular issue. It is to really embrace that and to work hand in hand with those two issues, attempting to support the child with both. There is an important underlying question, though, that I would suggest you think about, and that is, if you look at the child's pale optic disc, or you think about the child's degree of myopia or hyperopia, if you think about the fact that the child has an eye that turns in or turns out, strabismus, ask yourself, if that was the only condition that existed, would this child still be visually impaired? Of course, the answer is different for every child, but in general, it has been my experience that when the ocular condition is dominant, the CVI is generally not even diagnosed. In other words, if the eye doctor can feel convinced that this high degree of myopia or this extremely impacted optic nerve is the greatest explanation for why this child is not looking at faces or noticing things far away or has no interest in books and so forth, then they're going to stop there. Their diagnosis really is complete. So there's kind of an underlying message when both ocular and cortical are diagnosed, and that underlying message is it's likely that the CVI is actually the most impactful thing. Okay, again, I want to reiterate, one does not eliminate the other. We look at both synergistically. So I just want to really be clear that that the work that I do comes from my background as a vision educator, very heavily educated in the areas of ocular visual impairment. And so it is critical to me that we look at that piece and put it into proper perspective. Again, the CVI range has never been intended to be used with children who meet one or two criteria. The CVI range is used for children 9 months of age to early adulthood, for children who have complex and numerous needs, as well as children who have CVI alone, for children who are academic learners, for children who have functional needs, and for everyone in between. It is based on a set of visual behaviors that progress in a certain way, not on age or degree of additional disability. The key is, the skill is, it really lies in the hands of the assessor who hopefully is able to approach that child in terms of assessment using the CVI range, including all of the rest of their complexities, or in the absence of a high degree of additional complexities. It's not an easy job, and it requires a very skilled person. And so, my message, my kind of final message here is that if you resist doing the CVI range because it's difficult, you're right, it is. But take a great sense of pride when you can complete it appropriately and know that you have a pretty accurate view of where to begin and how to watch the child change over time. Thank you.